Did you know that 1 in 10 adults worldwide has diabetes, and nearly half of them don't even realize it? Type 2 diabetes often develops slowly, with symptoms that are easy to brush off or confuse with everyday issues like fatigue or stress. But ignoring those early signs can lead to serious health consequences. That's why it's crucial to recognize the early warning signals your body might be sending you. In this video, we'll break down what type 2 diabetes really is, the subtle symptoms you shouldn't ignore, when it's time to see a doctor, and how catching it early can dramatically improve your health and quality of life. What is type 2 diabetes? Type 2 diabetes is a chronic condition that affects the way your body processes blood sugar, or glucose. Normally, your pancreas produces insulin, a hormone that helps move sugar from your bloodstream into your cells, where it's used for energy. But with type 2 diabetes, your body either doesn't make enough insulin or becomes resistant to it. As a result, glucose builds up in your blood instead of being used properly. Over time, high blood sugar can damage your organs, nerves, and blood vessels, leading to complications like heart disease, kidney failure, and vision loss. Unlike type 1 diabetes, which usually develops early in life, type 2 diabetes typically occurs in adults, although it's becoming increasingly common in younger people due to rising obesity and sedentary lifestyles. Early symptoms you shouldn't ignore. Type 2 diabetes often starts quietly, with symptoms that can be easy to dismiss. But your body is smarter than you think, and it's trying to alert you. Here are some of the most common early signs to watch for: frequent thirst and urination. Excess sugar in your blood pulls water from your tissues, making you feel constantly thirsty. You may also find yourself going to the bathroom more often, especially at night. Increased hunger. When glucose isn't getting into your cells, your body thinks it's starving, even if you're eating regularly. This can lead to frequent or intense hunger. Fatigue. Feeling tired all the time? When your body can't use sugar effectively for energy, you may feel drained, even after a full night's sleep. Blurred vision. High blood sugar can cause the lens in your eye to swell, leading to blurry vision. If this comes and goes, don't just blame it on screen time. Get it checked out. Slow healing wounds and frequent infections, cuts and bruises that take longer to heal, can be a sign of impaired circulation and immune function, both common in diabetes. Tingling or numbness in hands and feet. Nerve damage, neuropathy, can start early in type 2 diabetes. If you notice tingling, burning, or numbness, especially in your extremities, it's time to talk to a doctor. Dark patches on the skin. A condition called acanthosis nigricans, often appearing as dark, velvety patches in skin folds like the neck or armpits, can be an early indicator of insulin resistance. These symptoms might not seem serious on their own, but together they paint a clear picture of an underlying problem. Don't ignore them. When to see a doctor? If you're experiencing any combination of the symptoms listed above, especially if you have risk factors like being overweight, having a family history of diabetes, or living a sedentary lifestyle, it's time to schedule a visit with your healthcare provider. A simple blood test can reveal whether your blood sugar is in the normal range, or if you're in a pre-diabetic or diabetic state. The earlier you find out, the more options you'll have for treatment and lifestyle changes. Don't wait until symptoms become severe or complications arise. Early detection is one of the best tools we have in fighting this disease. How early diagnosis can change your life. Getting diagnosed with type 2 diabetes, or even prediabetes, can be scary, but it's also empowering. Why? Because knowledge is power. When caught early, type 2 diabetes can often be managed, and in some cases, reversed, through lifestyle changes like eating a healthier diet, cutting back on refined sugars and processed foods, while increasing fiber and whole grains can stabilize blood sugar levels. Getting active. Just 30 minutes of moderate exercise a day can significantly improve insulin sensitivity. Losing excess weight. Shedding just 5–10% of your body weight can have a dramatic impact on blood sugar control. Monitoring your glucose levels. Keeping tabs on your blood sugar helps you understand how your body reacts to food, exercise, and stress. Some people may need medication, especially as the condition progresses, but catching it early gives you the best chance to avoid complications like vision loss, kidney damage, nerve pain, and even amputations. Type 2 diabetes does not happen overnight. It develops gradually, often without noticeable symptoms. Many people live for years with elevated blood sugar levels before being diagnosed. That is why it is so important to listen to your body and pay attention to any warning signs. Early detection and lifestyle changes can make a huge difference in your long-term health and well-being. If you have noticed any of the symptoms we previously discussed, such as frequent urination, increased thirst, fatigue, blurred vision, or unexplained weight loss, or if you simply have not had a routine health check in a while, now is the time. Do not wait. Talk to your doctor, get tested, know your numbers. If you are at risk, small steps today can lead to a healthier future. Your health truly is in your hands. Like, share, and subscribe for more life-saving health tips and practical wellness advice. And turn on notifications so you never miss an update. Stay informed, stay healthy, you have got this.